Dr. Ananda Kumar, could you share with us what inspired you to pursue a career in surgical gastroenterology and hepatobiliary surgery?
Basically, I was doing my MS General Surgery way back in 1994. During that time, there was no specialty called surgical gastroenterology, which was probably in few places like AIMS Delhi or Madras. So during that period, I was more of basically general surgery is nothing but GI surgery worldwide. But in India, what happened is people who are undergoing MS general surgery training supposed to do every surgery training in every organ, including neurosurgery to heart, and more concentration on abdominal surgery, that is GI surgery. But over the time, I felt there should be something called a focused training in any surgical field. Then I thought the best would be surgical gastroenterology. During that period where I wanted to become a surgical gastroenterologist, I happened to meet a surgical oncologist who is supposed to be the best in India, in Bangalore. His name is Dr. M. Chandrasekhar, who was the professor of surgical oncology at Kidwai. So, before becoming a good GI surgeon, I wanted to develop my surgical skills so that nobody should get, I would say, nobody should go back once they come to me thinking that, oh, this doctor cannot operate, difficult surgeries. So, I concentrated on hepatobiliary part of it when I was with him, because that man is called a walking god. It's almost we call in football there is something called hand of God. In my career, the hand of God is Dr. Chandrasekhar, who has literally taught me ABCD of surgery, and especially in hepatobiliary and pancreatic surgery. During the course of my training in surgical oncology, I was an emotional man. Basically, I wanted results and I wanted people to live on when I operate. But in cancer surgery, everybody thinks that once you diagnose cancer, whether you operate or do anything, the end result is death. So I was a bit emotional, and my mentor told, it is not possible for you to stick to cancer surgery because you want 100% results, which is your motto. So you better move to what is called a benign procedures, where you have 100% results and people will live in front of you for long years. Then I moved to surgical gastroenterology at Nizam's Institute of Medical Sciences, where I did my surgical gastroenterology training, and I continued there as my faculty at Nizam's Institute, where I fine-tuned my skills in hepatobiliary and pancreatic surgery. Why I specifically looked at hepatobiliary and pancreatic surgery? These are the most important organs and difficult surgeries to perform. We call them as very sensitive organs, and results, if you are not expertise in handling them smoothly, results will be very bad. So these surgeons should have a lot of patience. When you have a patient in front of you with hepatobiliary problem, you should have a lot of patience, where you can get the patient out of the woods by doing a peaceful and patient operations in hepatobiliary. That's why I developed more interest in, because I had a lot of patience in myself when I operate or when I treat a patient. So any GI surgeon should have a lot of patience, should not lose his temper or integrity while operating, because results are purely based on not just surgical skills and your application of mind and how cool you are on the table. People always say, Astavasi, your hand is very good, karke. In that way, I used to always tell my boss, sir, you have a very good hand, healing hand. The only thing he told me is, when you get into the theater, you should always pray that you are not operating. Think that God is come down and operating. So that is the way Astavasi effect of his has transferred to me. That's what most of the people say. Your hand is good, sir. Karke. That's how I developed more interest towards surgical gastroenterology.
Doctor, in your view, what are the most significant advancements in gastroenterology and hepatobiliary surgery in the last 10 years?
In the last 10 years, when I was getting trained in 1994, there was actually emerging laparoscopy or minimal invasive surgery. At least I had not seen what is laparoscope in my during my surgical training. After I completed my surgical training, when I underwent further training with senior mentors, I started watching. It's basically you can't even touch laparoscopes or minimal invasive technical surgeries because you need to get trained. First you have to observe, then you need to know how to handle, because the physical surgery with open surgeries, we are all used to open surgeries, cutting open the abdomen and doing surgeries. Technology has started changing from 1998 onwards. 1998, people started doing in India the surgeries in the abdomen of abdominal surgeries through laparoscope with small holes. We call it as minimally invasive surgery. Definitely in those last 10 years, if I say now we have moved even further to artificial intelligence called robotic surgery. But before that, it was laparoscopic surgery or minimal invasive surgery where we pass a camera into the abdominal cavity and use instrument to operate. And this needs lot of, again I will tell, this needs a lot of surgical knowledge, anatomical knowledge, because if you know open surgery, then only you can do a laparoscopic surgery. If you start doing laparoscopic surgery directly, then you can land up in problem. If there is any serious issue happening, if you have to open the abdomen, if you don't know the what is called open surgical anatomy and laparoscopic surgical anatomy are two different things. When you see through the camera, it looks different. When you open up, it looks different. So basically, I always advise a good open surgeon is always a best laparoscopic surgeon. So definitely for us, changing into new technique was much easier. Application of new technique. And we moved on to from laparoscopy, even hepatobiliary surgeries, we started resecting livers, tumors, we started doing laparoscopic gallbladder surgeries, we started doing stomach surgeries like bariatric surgeries, and most of the abdominal surgeries we started doing in laparoscopy. Most of the benign surgeries. Nowadays people are doing even cancer surgeries, but I don't know how far it is going to be what we call it as, when it comes to the cancer therapy itself, how far it is going to help the patient, really it has to be established over next few years. But definitely surgical gastroenterology moved technology wise into an extraordinary era in last 10 years. That is laparoscopy to robotic surgeries.
Sir, given your expertise in liver transplantation, what are the most challenging aspects of liver transplant surgery today?
Basically, liver transplant is nothing but another surgery. I always say people always project it as a surgery which is very difficult, very extraordinary, but it is another surgery where it is a technique which is involved, nothing else. First point, when anybody wants to do a surgical training in transplant surgery, again you need to be anatomically extraordinarily good. You should know what is the anatomy of the liver. The challenges in transplant era is in India. See, I was trained in Korea in liver transplant, but the people in Korea are so educated so that they donate their livers to their parents or any family without even questioning or thinking negative about donation. But in India, the biggest challenge is convincing the people about the use of donations. Liver transplant, organ donation. even after, see, most of the times we say donation means when the patient is dead, brain dead patient donating. That itself is becoming difficult to convince. But coming to see, from me getting trained in 2010 at Korea and coming back to India, when I presented myself to the corporate hospital, they were thinking, is it possible to establish a transplant unit? But from 2010 to 2023, now most of the hospitals are doing liver transplant. That means that technology has helped. The education of the people is much better, and the organ donation, people thinking of donating when their kith and kin die in an accident or a brain dead situation is increased. This was the challenge. Even now, the challenge still exists when it comes to live related donors. Live related donors in transplant, liver transplant, are getting scared, where people think that if they donate, they may die on the table or they may have problems in the future. But as a transplant surgeon, I always say, people with liver problem, if you have a possible donor at home who is mentally healthy, physically healthy, don't have diabetes or any other chronic diseases, can happily donate part of his liver to his kith and kin and save him from death. So, main challenges were educating the people. But I still feel the cost, the challenge is cost. Basically, I don't know, the equipment required is quite costly. The ICU is a challenging care, post-op care, which is still has to be improved in Indian scenario. Those are the main challenges which we face, basically post-op care and patient follow-up. In Indian scenario is, patient always thinks once the transplant is done, he can do anything under this on this earth. But successful transplant is not just putting your liver, a new liver into your body, but after that how you follow up with your doctor or with your lifestyle is going to make the patient live longer and longer. Otherwise, the results are going to be pathetic, because a good follow-up, educated patient, and following your doctor's advice very neatly, like what we follow in Korea. There, if you don't come on the day where I have given you date, you are thrown out of the transplant list. That means you will be out of the treatment and you will not be given any free treatment there. In India, it is difficult to get a free transplant or free treatment for transplant patients. But still, if you want to live long after transplant, follow your doctor regularly. Don't neglect even a day. If you have a problem, visit your doctor. And convincing these kind of things to any patient is difficult. The challenge starts from educating the patient, patient family, and educating the patient itself. The surgery is not a difficult issue, because transplantation is like any other surgery, where we join the duct, artery and vein, and there ends the matter. But after that, after care exclusively depends on the patient.
Sir, could you please discuss any groundbreaking research or discoveries you have been involved in your career?
Basically, I was in Nizam's Institute. The groundbreaking research I was involved is, there was a new drug challenge coming up in worldwide actually. There was drug resistant organisms, multi-drug resistant organisms all over the world, which were responsible for most of ICU deaths. And they started a new research molecule during that time, where it was difficult to get the people educated when you are giving a trial drug. So I was one of the international research person who was involved in that molecule, which actually we should not be telling the drug name, but it was a challenging drug which was actually removed from the textbooks because of its complications few decades back, but we reintroduced and studied all over the world, and it was challenging, but we were successfully able to demonstrate that it was the safest drug for any GI surgical problems during that era. It was in 2003 and 2004 where world needed a new drug, and that was the groundbreaking research which people that made me say research is very tough, but to get a proper result we need to have a dedicated team to involve in research.
Doctor, where did you see the field of surgical gastroenterology heading in the next 10 years, especially in the context of emerging technologies?
See, I always believe in open surgeries because if you want to have good results, people should know there is nothing beyond open surgery. In the era of new technology, I am seeing possibly we may land up in trouble in the next coming few years because we started using minimally invasive approach, we started using robots or artificial intelligence where people, when you get trained from basic surgery to advanced surgery, if you don't know how to open abdomen by hand, what is called a open technique, in case of any difficulty or failure of artificial intelligence or technology breakdown, you don't know, technology is never permanent, technology keeps changing, but if there is a power failure, if there is a instrument failure, if there is a machine failure, you should be able to replace that moment and save the patient by knowing the open technique. Definitely the technology is going to take over human in the next decade, but that is not a good sign for human science. Basically nothing replaces these 10 fingers for an operating surgeon. If you are using a machine, if the machine is not working, nothing can move forward if you don't know how to open. It is nothing but if you don't know how to cook by cutting each one vegetable or whatever and put them into a cooker or a tumbler to cook. If you use a machine for everything, for your food, if the machine fails, if you don't know how to cook, you have to die with the hunger. That's what I say. Technology should be supportive, should not be exclusive. Robot should not be exclusive, but it can be an additional tool to expertise, but be authoritative on your open technique. That is why we always say we are moving towards mannequin surgeries or anatomy based on artificial intelligence. So what I suggest is nothing can replace a human body, where we all learnt on a cadaver, a dead body, where we have dissected each tissue, each structure and knew where it goes, where it ends and where it starts. That's how the training should be. If you are getting trained in a technological way like artificial through the computers, there tend to be a disaster. Definitely it is not good for saving human life. That's where definitely artificial intelligence will take over, but it will create a disaster in human society.
Doctor, what advice would you like to give to medical students or young surgeons who are aspiring to specialize in gastroenterology or hepatobiliary surgery?
Basically, I always say to my students whom I used to teach, if you have to be practically too good and technically too sound to deliver the goods. For that, don't expect your just 3 years of training or another 3 years of specialty training is going to make you a big surgeon overnight. Basically, my logic is a surgeon's life starts after 40. not at 35. By the time you finish all your training, it will be around 32, 33 years. And another 6 to 7 years, you have to put yourself under somebody who is extraordinarily good, who knows open surgery, who knows laparoscopic surgery, who knows robotic surgery, all together, and you get trained thoroughly before you put yourself knife onto any new patient. That makes you a perfect surgeon and a competent surgeon, and definitely your results will be 100% positive. Otherwise, just finishing a degree and coming out and starting your practice is going to be a disaster. That's where I advise to the new students, learn on human, and if you want to experiment, definitely people are ready to subject themselves in medical colleges or somewhere where your teacher is going to teach you everything step by step. But learning on computers, learning on just mannequins and experimenting onto human cannot be extended. So learn with your teachers, stay with your good surgical teacher, like what I did. I stayed with my mentor for 3 years and I never expected money. I asked him only, teach me, make me a good surgeon when you ask me to move out and practice. That's how you should be. So basically nowadays what people, the new generation is, as soon as they complete their surgical training, they want to come into practice and earn money. If you start thinking of earning money, don't become a doctor, because no doctor can earn good amount of money till the age of, I would say, 4th decade, till you are 40, and experienced surgeon. That's what I suggest for these people, to have excellent training before you put knife onto any of the human body.
Doctor, could you please elaborate on philosophy of patient care, especially in complex surgeries?
Basically, most of the patients who come to me are either rejected or operated multiple times at different places. They come to me for difficult surgeries only. No one will come with for simple surgeries. For simple surgeries, basically I don't even discuss much. Complicated surgical surgeries like liver resections or pancreatic surgeries or any difficult surgeries which needs lot of patience, I will sit and talk to them for probably hours together and repeated sittings. I don't subject them to, as soon as they come, I won't just straight away tell this is the problem, let you get admitted and operated. I'll always sit and talk to them politely, patiently, and I will give lot of human touch to them. I will ask them, write down all your queries, don't go to internet, whatever problems or doubts you have, list them out, sit and talk to me one by one, and I will definitely repeat when they come for second day for another sitting. I will repeat the same thing, so that patient should be very well educated before going into a major surgery, because the complications involved with liver surgeries or pancreatic surgeries, hepatobiliary surgeries are enormous and may not be able to revert. We may not go back and correct it after closing the abdomen. So we have to be excellently technically, we have to have a lot of patience, we have to be with the patient in throughout their journey till they recover. We can't be harsh to them when they are in pain, and my philosophy is patient first priority. I will see that till the patient completely recovers. I give them all the possible explanations regarding that, including the attenders. Basically, patient will be on the bed, but it is the attenders which needs to be managed, or a family members which needs to be managed more, because they are worried when my kid is going to be all right, or when my mom is going to be all right, or when my father is going to be all right. So you have to be a part of the family and take them through that pain for a successful surgery. Basically, surgery anybody can operate. I always say, anybody can operate these surgeries, but the results cannot be the same if you are not a compassionate surgeon or if you are not with the family or with the patient and boost their morale. Because I always say, my surgeries absolutely correctly went on well. If you want to recover, you have to have three things in life. One is you have to trust my surgery. You have to trust yourself that you are going to be all right. You have to wait for nature to give you a healing process, because nothing pushes or heals. There are no medication in the world which makes you heal perfectly if you are not strong on your mind. So I make sure this holistically. I manage from psychological point of view, technical point of view, and medication point of view, and even after recovery. So this is a long process, because these major surgeries involve at least 3 to 6 months of putting the patient back onto his wheels. So you have to be very compassionate surgeon and be empathetic towards the patient. And I make sure all this is followed throughout my surgical life.
Doctor, could you please tell us how important is team collaboration in complex surgical procedures and how do you foster this in your practice?
Basically, there are few things, sir. Surgery might take 3 or 4 hours, some people take 10 hours, but the team which is involved in the surgery, it starts, I always believe, the care starts from the fellow who is standing in front of the gate, that is my security. I will always teach everyone to respect the patient, give them positive confidence, and the fellow who is in the reception who handles such difficult, painful, or what we call it as suffering patients, and everybody together, and surgeon and the team inside the theatre, you have to have an excellent coordination. I always say, if I am a successful surgeon, there are 3 people involved in it. One is my nurses who are in the ward, who does sacrifice all their egos, everything, and so friendly, and they don't hesitate to even clean up the patient. They don't feel bad about touching infected patient. Those nurses and the theatre nurse, half of the surgery is done by your theatre nurse. I always say, because she should know what steps you are in, what suture you are using, next what instrument should go. That means this is called a complete coordinated action. If there is one person which is not coordinating, the whole team gets disturbed. The assistant surgeon is off surgeon. We always call it as the person who was assisting me from the other side is going to be off surgeon. I will only be probably doing the procedure, but rest of the things, the showing the camera, showing the operating area, and making my movements easy is a teamwork which is in the theatre. I have carried all the people along with me. They have come with me wherever I go. So that is called, it is like a family. My team, from my secretary to my theatre nurse and my critical care team, everyone is followed me in the last 20 years. This is, I consider my team as a family where everybody has differences, but we need to adjust and move in life. But definitely any successful hepatobiliary or major surgical, complex surgical results are going to be dependent on not just the surgeon, it is the whole team. And when it comes to ward, my nurses who have taken care of these patients, because no surgeon or a doctor is going to be with the patient 24/7. It is the nurses which are going to be with the patient. So all if I am successful today in a complex surgeries, I always dedicate that success to my team rather than me taking it alone. For patient, it is always Dr. Anand who has given life, but I feel we have shared that responsibility. All of us have shared that responsibility. And a successful surgeon will always have a successful team going with him and maturing throughout the journey of his surgical career and supportive all the time. Because any surgeon who walks into the theatre, people always think, oh, Dr. Anand is a great surgeon. But the amount of pressure we will have, it has to be diffused or taken over by someone else or distributed to people around you, and they should take that responsibility. Then only my surgery will be successful. So that's how I have developed a team, and I expect every surgeon to have such kind of team to have very good results.
Doctor, what are the biggest challenges facing healthcare system in India, particularly in surgical specialties?
The healthcare system in India is basically the one thing which I feel is the specialties. People with special training are focusing only on metro cities. For example, Hyderabad has more specialists which is not required, but they should be redistributed to the smaller cities or district level hospitals. They have to move and start practicing there, because every patient, you cannot shift every patient with complex surgery who need complex surgeries to bigger cities. You should be able to do them even in smaller cities also, because nowadays every hospital is equipped with special instruments to do that, and every hospital would have had ICU care. So you need not worry to shift everything to metros. The fear is, the thing is, it may collapse. The healthcare system may collapse because the required number of surgeons are more concentrating on cities than the required area. If you take the requirement, if you take for every 1,000 population, if you need one doctor, in Hyderabad we have more, probably every 500 patients or population as one doctor. If you take specialist also, it will be more. If you take from MBBS, what is called it as general practitioner, to physician to specialist. So all are getting congregated only in one area, which is not a good trend. And even hospitals, corporate hospitals. See, basically the thing is, everyone is scared of corporate or private hospitals because they think they are going to charge very heavily. Definitely the cost in private hospital will be more. That why these challenges are faced is, in spite of extraordinary medical colleges or general hospitals or public hospitals like government hospitals, we are not seeing the upgradation of technology in government hospitals. At least in last 10 years I have not seen any change. Even if it is upgraded, probably there is no one to train or get trained. Probably even they want to practice in private practice. That is how I looked at it. That's what the challenges are is, you have extraordinary number of patients population in government hospitals. If I have 10 surgeries here, you will have 100 surgeries in government hospitals. So the training capacity is more. You get trained better in government hospitals and you can perform complex surgeries in that situation. Only thing is, the problem with our public system is nobody wants to take the responsibility. That is the issue. When it comes to private, because I am solely responsible for every patient, I do, and I definitely take that responsibility, which is definitely involved cost. So obviously, if you compare to Western countries, our private hospitals charges are absolutely nominal. If you go to US, if you want to have a consultation, it is going to be $200. Here my consultation is around 900 rupees. Imagine what is the difference. The quality is extraordinary here. The reason is I am available 24/7. I can be accessible over the phone. That is the only country where a consultant can be called in the middle of the night by the patient. No other country gives that opportunity. But still people think that my consultation charges are high. But the quality of care you get in India, whether it is public or private, is extraordinary. One is empathy, sympathy, and forget about affordability. I treat a person who don't have money with the same sense of owning the patient, rather than this fellow has given me less money, I should not care about him, or somebody has paid me more, I should give a special care about. Everybody gets equal care here. The challenges are nobody stays. Basically, the nurses who are working in the hospitals don't continue to stay. The employees doesn't want to continue to work. This is called lot of attrition problems, and you need to train each and everyone, like not in US or UK, where if you join at one place you are there for at least 2 years. Here the people come and go, and I need to train every day. The problem here is people don't want to stay at one place peacefully. So these are all the main challenges which we are facing, and at the same time, as technology takes over, the cost of treatment also goes up. So what I suggest is people should start believing in doctors, and you should have health insurance and pay. I always say, when you earn 100 rupees, at least 25 rupees you save for your health. Pay insurance 25% of your earning to insurance, health insurance, where you can you need not pay a single pie from your pocket when you walk into a hospital. Then you will not think of expenses. But people, even repeatedly when we explain them to have insurance, people always think, I am healthy sir, why should I waste my money? People always use this word, but you never know who can become sick, when they become sick, and how much they are going to need to shell out when you get into a hospital. Because nothing comes free in any hospital. Even in government hospital, government has to buy the equipment, government has to buy the medication. So nothing comes free. Everything is through the taxed money. Somewhere people have to understand that when we get into a private hospital, it is investment is by private and it has to be generated. When it comes to government, you are not paying from your pocket, you feel it is not a good care. But I feel I have been trained exclusively from all through my career in a government institute only. I have become best today because of government hospitals only. Don't ever think that government hospitals are inferior in care or inferior in treatment. They are the best. Yes, when it comes to private, you will get a prioritized treatment, you will get a prioritized room, you will get a neat room, somebody to say hello to you, there will be many people, but it will be charged. Otherwise no private hospital can sustain the amount of infrastructure they invest, the amount of maintenance costs involved, the amount of recuperating costs, recurrent cost involved. So definitely the cost of private care is definitely going to go up, and I feel it is because of technology, and people want technology. Obviously the price will go up. That is the major challenges in the healthcare which I feel in the coming years.
As a surgeon, what advice do you find yourself giving to patients about lifestyle and preventive care?
Basically 90% of our problems are our lifestyle disorders. See, from 20 years to 35 years of age group, the diseases are becoming much more nowadays. The reason is most of them have very unhealthy habits. most of them are sitting and working, most of them are stressed, most of them don't sleep properly. So if you don't have any proper lifestyle like eating in time, eating good food in time, having good habits, you talk to any youngster today, 99% of them they drink, smoke, or addicted to some other habit which disturb their life. And the fourth is obviously 24/7 stress. These things have to be streamlined, as the diseases of new age problems are 90% of them are curable by changing your lifestyle. One is eat good food, stay away from addictive agents, sleep well, be happy with whatever you have in your pocket. Don't imagine the fellow next to your house is richer and you can become richer by thinking or by not sleeping. So I always say, curtail your thoughts, have a very good sleep, good food, even if it is a small amount of food, home food, and avoid drugs, as I say, addictive agents. And fourth is, at least give your body an hour of work in the form of walking. People always go to gym. I am dead against gymmers. Go for a walk, go for a jog, use one cycle. It is very cheaper. And people who walk are 100 times healthier than people who go to gym. This is what I suggest. Take care of your health. Your health is 99% of the times is because of your ill habits. This is the main suggestion I can give to youngsters.
Can you tell us more about Ananda Gastroenterology and its inception?
So basically, the concept of gastroenterology in Hyderabad was only about one hospital, which everyone knows. When I moved into private practice, there was no surgical gastroenterologist in the city in any corporate. Then people started questioning me, saying that, Anand, you are a surgeon. I wanted to start a clinic, a small clinic with a room by 9 by 9 and spend my time so that I can build my practice. What I did is, I started it as Ananya Gastroenterology, which is my daughter's name, and I felt my daughter is lucky for me. So I started as a small clinic, and people discouraged me, saying that you are a surgeon, nobody will come to you. But initially I also thought probably surgeons won't have any private practice or clinic practice, and I started projecting that as my virtual hospital. Basically, people started imagining Ananya Gastroenterology as an hospital in their mind, and I projected in that way. And over 7 years, I made that product into a bigger product called what is Ananya Hospital today. But in this, I have honestly done it without paying any commission to anybody. I gave my whole and soul to patient. Patients have built this hospital rather than I built this hospital. Definitely, in the era of where we are in the quid pro quo life, where if somebody refers a case, you need to shell out this one. I have always honestly made it a point that I should not be at least one person should be an example in the society who doesn't pay any commission to anybody. I give that whatever little bit which people call commission, that concession or discount, to hand it over to the patient rather than doing at a cheaper rate, rather than going and asking people to send patients to you. That's how Ananya Hospital stays or above about any other hospital when it comes to patient care or honesty or ethics of the practice. That's how I built this, from a virtual small clinic to a visible large hospital.
Doctor, thank you for giving your time and sharing us your valuable information. Thank you.